Have you ever wondered whether you are preparing for the right UK dental exam? Every week I receive messages from dentists asking the same question. Should I prepare for ORE or LDS? Which one is easier? Which one is faster? Which one gives me a better chance of working in the UK? The problem is that social media is full of opinions. One person says ORE is the only option, another says LDS is much better. After reading all those comments, it is easy to become even more confused. But the so right now in this video, we are not going to follow rumors or personal bias. We are going to compare ORE and NDS side by side, looking at looking at the official structure, the exam pathway, the cost, the waiting time, the difficulty, and most importantly, which route might be the right choice for you. I also want you to stay until the end because there is no difference that many candidates don't discover until they have already started preparing, and it can completely change your decision. So let's begin with something that surprises many candidates. Although ORE and LDS are different examinations, they both have same overall goal. They are routes that allow eligible overseas dentists to work towards registration with the General Dental Council provided all requirements are met. Think of it like traveling to the same destination using two different roads. Both roads are trying to take you to the same place, but the journey, the checkpoints, and the experience along the way are different. This is why comparing them properly is so important. Choosing the wrong route for your circumstances could mean spending more time, more money, and more effort than necessary. So, now let's answer one of the biggest misconceptions. Many candidates think ORE and LDS are simply different names for the same examination, but they are not. The ORE is administered by General Dental Council, which is the regulator responsible for dental professions in the UK, while on the other hand, the LDS is awarded through the Faculty of Dental Surgery at the Royal College of Surgeons of England. So, although both pathways can ultimately support registration, they are organized by different institutions with different examination structures. Understanding who runs each exam helps explain why the processes, exam format, and progressions are not identical. So now let's compare the structure. If you are considering the ORE, you would need to compare two parts. The first part focuses on written knowledge through single best answer questions covering applied basic sciences and clinical dentistry, while ORE Part 2 assesses practical clinical skills, communication, diagnosis, treatment planning, and medical emergencies in a structured clinical environment. While the LDS follows a different pathway, instead of two parts, candidates progress through three stages. You begin with a written examination before moving into structured clinical reasoning and OSCE style assessment, followed by practical clinical skills. At first glance, the difference between two parts and three parts might seem small, but later in the video, you will see why this difference can affect your preparation strategy, your timeline, and even your overall costs. Here's something that often gets overlooked. Many candidates spend so much time comparing pass rates or waiting times that they forget to ask the important question that what does each exam actually expect from me? So I will tell here the ORE is designed to assess whether an overseas dentist can demonstrate the knowledge, skills, and professional behaviors expected for safe practice within the UK dental system. Throughout the process, you will encounter applied sciences, clinical decision making, communication, practical procedures, and patient safety. The LDS also evaluates competent dental practice, but many candidates describe it as placing a strong emphasis on structured clinical reasoning alongside practical skills and knowledge. So, whichever route you choose, one thing is absolutely clear. Neither examination revolves memorizing textbooks alone. Both expect you to think like like a safe clinician, justify your decisions, communicate effectively, and apply your knowledge to real patient scenarios. And that's exactly why choosing the right strategy matters just as much as choosing the exam itself. And now next. Moving forward, we will talk about the waiting time. Now, let's talk about something that many candidates don't think about until they have already started the process waiting time. Passing the exam is one challenge, getting an exam seat is another. Historically, ORE candidates have often faced long waits because demand has been much higher than the number of available places. Many dentists have spent months preparing only to find themselves waiting for the opportunity to set the exam. The good news is that the GDC has announced plans to expand ORE capacity, so this situation is expected to improve over time. But competition for places is still something every candidate should be aware of. LDS has its own timeline, although some candidates may find earlier opportunities for certain paths. It also has multiple stages that must be completed in sequence. So don't ask yourself which exam is quicker. Ask yourself which journey fits my situation better. Because the shortest route on paper is not always the fastest route in real life. So one of the most searched question online is which exam has the higher pass rate? It's a fair question, but it's also one of the easiest statistics to misunderstand. Pass rate can change from year to year. They also depend on the experience of the candidates sitting that particular exam. A higher pass rate does not automatically mean an exam is easier. Likewise, a lower pass rate does not necessarily mean it's harder. It may simply reflect differences in candidate preparation, exam format, or the group of people taking that setting. So instead of choosing your pathway based only on pass rate, ask yourself another question. Which exam format matches the way I learn and demonstrate my clinical skills? That question is often much more useful than comparing percentages alone. Here's the difference that many candidates don't discover until much later. If you complete the ORE successfully and meet the registration requirements, your reward is eligibility for full registration with the General Dental Council. With the LDS pathway, successful candidates can also work toward JDC registration, but they additionally earn the LDS diploma awarded by Royal College of Surgeons of England. For some dentists, that extra qualification is professionally meaningful because of its long history and recognition. For others, the priority is simply becoming registered and started working as soon as possible. Neither answer is right or wrong, it depends entirely on your personal goals and career plans. So, which one is more difficult? This is probably the question everyone wants answered. So, which exam is actually harder? The honest answer is that there is not a universal winner. Many candidates describe the ORE as being highly structured and closely aligned with UK clinical guidance. Others describe the LDS as placing strong emphasis on clinical reasoning and decision making. But difficulty is not determined by comments on social media. It's determined by your own background, your clinical experience, how you study, and how well you perform under examination conditions. Rather than asking which exam is easier, I think a better question is which exam gives me the best chance of succeeding based on my own preparation. That's the mindset that leads to better decisions. Now, let's put everything together because every exam has strengths and weaknesses. Starting with the ORE, one of its biggest advantages is that it was specifically designed for overseas qualified dentists who want to practice safely in the UK. The entire examination pathway is built around assessing whether your knowledge, clinical skills, communication, and professionalism meet UK standards. Another advantage is that the ORE consists of two parts instead of three, making the examination structure more straightforward. The GDC has also announced plans to expand examination capacity, which is encouraging for candidates hoping for more available places in the future. Now, let's look at the LDS. The biggest advantage is prestige. Successfully completing the LDS means you gain the historic diploma awarded by Royal College of Surgeons of England alongside the pathway towards JDC registration. Many candidates also appreciate the academic tradition behind the examination, especially those who value holding a Royal College qualification. So, your priority is a pathway designed specifically for overseas dentists. The ORE may appeal to you. If you value the additional diploma and the heritage of the Royal College, the LDS has its own unique attraction. Neither pathway is universally better, they simply offer different strengths. Now, let's talk about the challenges because this is where many YouTube videos stop being honest. Okay. The biggest challenge when ORE has historically been in demand, even highly prepared candidates have sometimes faced long waits before securing examination places, although capacity is expected to improve. The ORE also does not award an additional diploma beyond the route to JDC registration. So, if you are having a Royal College qualification, is important to you, that's something to consider. For the LDS, the exam challenge is that the examination is divided into three stages. That means more milestones to complete and potentially a longer overall journey before finishing the entire pathway. Both routes require serious preparation, financial planning, and commitment. There is not a shortcut, so don't choose the exam because someone online said it was easier. Choose it because it fits your goals, preparation styles, and long term plans. So, which one should you choose? After comparing everything, you might still be wondering. Just tell me which one you would choose. The truth is, I can't answer that for every candidate because your circumstances matter. If your main goal is to follow the pathway specifically designed for overseas dancers and you're comfortable with the structure, the ORE may be the route that suits you. If you are interested in earning the Royal College diploma and you are comfortable with additional examination stage, the LDs may be worth considering. Instead of asking which examination is better, ask yourself these four questions. What are my career goals? How much time can I realistically dedicate? What is my budget? Which examination format matches the way I perform best? Those answers are far more valuable than anyone else's opinion. In the comments, you can also comment me and I can help you deciding which pathway you should go for. So, final message is if you watch until this point, understand something that many candidates did not. ORE and LDS are not competing exams. They are two different pathways that can help eligible overseas dentists move toward practicing in the UK. The right choice depends on your own goals, your preparation, and your circumstances. Now, I'd like to hear from you. If you were starting from the UK dentistry journey today, which pathway would you choose, ORE or LDS, and why? Leave your answer in the comments. I will read every single one, and your perspective might help another overseas dentist who is trying to make the same decision. If this comparison helps you understand the differences clearly, subscribe to Last Night Dentistry. Over the next few weeks, we are moving beyond booking updates. I will be covering medical emergencies, ORE Part 1 revision, Part 2 preparation, treatment planning, radiology, communication skills, and complete UK dentistry career guidance. My goal is simple: to build one of the most reliable free resources for overseas dentists preparing for ORE.